All right. Good evening, everyone, and welcome again to another episode of MJ Make My Day. And we are streaming live from New Jersey, I meant. All right, so we're actually live right now, and if you're watching in the Philippines, we're also live. Thank you very much for joining us. And this is the episode of The Glass Half Full. Thank you so much. All right. Good evening, everyone. My name is MJ, and you're watching MJ Make My Day, a special edition episode of The Glass Half Full. Tonight, if you're watching from New Jersey, we're actually streaming live. And of course, if you're in the Philippines, magandang umaga po sa inyong lahat. This is MJ Make My Day, The Glass Half Full. Tonight's episode is going to be very, very exciting. We have a special guest, of course, our experts, Dr. Lisa Blanchfield, and of course, Dr. Azzat will be joining us. Okay, before we continue, I would like to share to you that the topic for tonight is the effects of COVID-19 pandemic to our caregivers. Approximately 43.5 million people in the United States are caregivers to a family member with a disability or illness. These people are termed informal caregivers as they are seldom trained for this role, nor do they necessarily desire it. These informal caregivers provide indispensable health services to their family members and are considered by many policymakers to be frontline health service providers. The economic value of services provided by informal caregivers was estimated to be $470 million in 2013. In the best of times, caregivers have high level of stress and depression. Caregiving can affect a caregiver's emotional well-being, finances, and routine social activities, as caregivers often feel unprepared for the role due to a host of personal factors and lack of skills. These effects are reflected in perceived caregiver burden and stress due to caregiving, as well as depression and health problems. Little is known about how stress, depression, caregivers, well-being, finances, and routine social activities are changed during a pandemic such as COVID-19 or coronavirus disease, a disease caused by novel SARS-CoV-2 virus. Already stressed, caregivers are trying to navigate these difficult times along with caring for friends or family. What effects does the COVID-19 pandemic have on our caregivers? We're going to discuss that in a short while. But before that, I would like to introduce to you our first host of the Glass Half Full. She has been a licensed mental health counselor for 15 years and studied in Ireland for the past 8 years. She's experienced with providing counseling to all ages, and her focus has been cognitive behavior therapy, mindfulness, and building a resilient life. She has been working in both inpatient and outpatient community settings during her 30-year career, to include being a counselor after 911 for the city of New York, and is currently providing counseling during the latest pandemic crisis. Author of your weekly journal of positive wellness and affirmation, please help me welcome licensed mental health counselor Dr. Lisa Blanchfield.
Hello, good evening.
Thank you very much, Dr. Lisa. We're going to talk to you more later on. Our next host of The Glass Half Full show, author of Make Your Dream Come True, and co-author of Overcoming Cultural Bias as a Roadblock to Success, author of The Next Big Thing, Possibilities for Self-Development and Goal-Setting Strategies for Optimal Success. She is a family nurse practitioner who is based or board certified by the American Nurse Association and a license by the state of New York to provide family-centered healthcare to patients of all ages. She is committed to leading the journey to teach the importance and value of a culture-specific approach in caring for individual needs, building communication skills to bridge the gap between individual groups and communities, and supporting the role of the healthcare industry to embrace aging by promoting an atmosphere that enables patients to maximize their individuality, independence, and dignity with the instinctive ability to focus on each resident's specific needs, desires, and quality of life. Please help me welcome Dr. Azza Azzat. All right. Good evening, Dr. Lisa and Dr.
It's
Azza.
good to meet again. Thank you
Absolutely.
for having me. It's good to meet again. Thank you.
Absolutely. And tonight we are going to talk about the effects of COVID-19 pandemic to our caregivers. And later on, we are going to introduce our special panel for tonight. We have Ms. Roberta, Ms. Sylvia, and Diana. Okay, I'm going to start with you, Dr. Lisa. Please take the floor.
I think we've had discussions before about what's been happening in the past year for all of us, and I think it's been very stressful. And I think that for healthcare providers in particular, they've had the burden of providing services, medical, mental health, emotional support. And I think with all of the illness, especially for those that are frontline, it's been very trying, and we are now seeing the trauma that actually has occurred for most all of us, but especially for frontline workers, caregivers, people that are in the helping professions. It's just been such a traumatic time. Basically, what we thought was going to last, we started in the beginning of the pandemic talking about weeks and then months, and now we are past the 1 year mark. So it's something that we're all very burned out about. I think it's emotional burnout for everyone, but I think that our purpose and our discussions are trying to allow us to talk about how we feel, and then hopefully give some strategies to people, whatever's working for us and what we talk about together, we can usually share with our community and people that are listening tonight.
Thank you very much, Dr. Lisa. All right, let me turn you over to Dr. Azza Azzat.
Okay, I'm just going to echo on what Dr. Lisa had just mentioned now. Being that living in this time, that tough time of the century with the COVID-19, we're talking not just about the healthcare provider, we're talking about the caregiver as well. It's affecting more society, community, family, and it's not in a positive way. It's affecting them mentally, physically, emotionally, and financially. So we all have to understand, because by understanding we can either give a hand or just be more kind of understandable where things are going and what the nurse is going through, what she's going through, and the nursing is still going to work and understanding their job, and they did not leave the field. They are still putting their life and their family and everybody else. And I'm amazed that with that kind of level of professionalism, not just for the nurses, but nurses more than anybody, any other healthcare provider. And it's time that everybody, I believe, will be acknowledged the role of the nurse. And I see the future of the nurses that is going to really flourish. And it's up to us to take it level further, because almost every nurse is a mother, is a daughter, is a friend, and it's affecting her, not just her health and her life, is affecting the whole community and her circle of relationship as well.
Thank you very much, Dr. Azza. All right, moving forward. All right, we're back. So moving forward, I would like to introduce our special panel of guests before we continue. And I'm going to ask you a question before I start doing that. What is caregiver stress, especially during the time of pandemic? According to study and research, also there are mental health concerns that is actually happening right now because of the COVID-19 pandemics such as depression, anxiety, subclinical stress, and high rates of negative affect including guilt, sadness, dread, worry, ambivalence about care, witnessing the suffering of relatives, becoming easily irritated or upset, feeling isolated or abandoned by others, anticipatory grief, a lot of things. Okay? But before you answer my question about what is caregiver stress and what can caregivers do to prevent stress and burnout, please help me welcome our panel of guests for this evening. I would like to ask everybody to please introduce yourself. We're starting off with Mr. Roberta Kiwan. Ms. Roberta? All right. Ms. Roberta? Hi, good evening.
Sorry.
It's all right.
So there's a lot of caregiver stress and a lot of stress on the people that are sick and the people around them. And aside from that everybody spoke of, but nobody mentioned the suicides. There's heavy duty stress and depression, but there are a lot of suicides coming up, exacerbated by all these things that everyone's talking about. So I just wanted to throw that in.
Absolutely.
Yeah.
All right. And we're going to be...
Roberta, you're a nurse for how many years, Roberta? You did not just mention that. Oh, I'm a nurse since 1978.
Wow.
That's 11 years.
By the way, I know it's kind of too early, but we are celebrating the International Nurses Week next month from May 6th to May 13 rather. So congratulations in advance to you, Ms. Roberta, and to all of our heroes, our nurses.
Thank you.
Okay. All right. Thank you very much. We're going to get back to you, Ms. Roberta. I would like to introduce to you part of our panel is Ms. Sylvia. Ms. Sylvia, good evening to you.
Good evening, I'm called Sylvia, and I'm happy to have you this evening, and I'm invited participants for the end.
Thank you very much. All right, so I'm going to give the floor to you, and of course, Diana is with us. If you would like to share anything, Diana. She's actually a student of the New Jersey City University, located in Jersey City, and she's a public health student also, and a member of Health Sciences student organization. Diana, all right, we can hear you.
Hi, my name is Diana Mugaka. I'm an intern from NJCU for public health. Yeah, I'm happy to be here.
Thank you very much, Diana. All right, so would you like to start the floor, Dr. Lisa?
Do we have Christina or?
Okay, is Christina with us? Christina?
Yes, hi, I'm Christina. I'm actually a new grad, but I've been in the nursing field since since 2001. I was an EMT and then went from EMT to OBGYN, from OBGYN to psych, and then to med-surg. So I've kind of been all around. And right now I'm working in med-surg. I was right in the middle of the pandemic where we were treating all of the, COVID-19 patients. I was on a COVID-19 floor. So we had a lot of, situations like, I feel like I was able to keep my composure, but there's a lot of triggers that I had to overcome. Like there was PTSD that everyone was feeling, but I was able to notice it for me faster than a lot of my coworkers had, where they were at home and they would be triggered, their PTSD was triggered by things like something like as easy as putting a Christmas tree up and having a conversation with their sister. And then all of a sudden they would burst out and start crying and going over these things, because I could tell you that in all the years that I've worked in the nursing fields, I've not dealt with as much death as we had in such a short amount of time, and there was just nothing we could do. Like, you could throw everything at you that you could at these patients, and you didn't know which way it was going to go. And people are still trying to get, through this, and a lot of people are seeking help and talking to therapists in order to, like, really get to the root of the issue, and find out what their triggers are and how they can deal with it. That's where we are right now. I mean, it's not only affected us as, we were all concerned we mourned every single loss that we had. And then we also mourned for the family that we had to call and, help them to say their last goodbyes to their patients, and had to encourage them to, connect with them. We didn't know what was going to happen next. And some of them were older, but we had a lot of younger people, and watching a 45-year-old, a father of 3, have to say goodbye to his kids and his wife, because we don't know what's going to happen next.
Mhm.
It was very emotional for everybody in the room. So these things really took effect on everybody. And nobody really can address it's not one issue. It has to be addressed as a whole.
Mhm.
And because it's not just the patients, it's not just the families, it's not just the caregivers, it's everybody as a whole has been really, really affected by the situation. And even the isolation and quarantine and how that's exacerbated, people's depression and isolation. It's been, I think it's been hard all around. And I think, we're just trying to be supportive of everyone and get through it.
Plus the
Absolutely.
fact that you take it home, I believe, right? You take all this stress travel home. So
Yeah,
it's
because-
just like you're exposed to the trauma, but you are carrying the trauma and you are dealing with some issue, and you're just releasing some of the stress in the wrong direction, I would say.
Yeah, that's where the triggers come in. Like, so you start doing something normally that you would do normal throughout the day, and then all of a sudden you'd be brought back or triggered to, a patient that you lost out of nowhere. Because somebody was just talking about, how did you deal with, the loss of your patients, and all of a sudden you go back there and you break down because you never really, you mourn it and you put it in the back burner and you don't actually, talk about it and get it out. You just bury it. So then once that raw emotion is brought up from a memory, now it's fresh in your mind. Now it's right there. So it's dealing with it, and it's hard for everyone to actually bring it to the forefront and deal with it. So they bury it.
And Lisa, don't you think that reminds you of the war? I mean, with when there's like a war and soldiers and Marines and people who are on the front line, and that's exactly almost the same issue that they were dealing with?
I really think that we're not recognizing it as probably the most traumatic time that we've gone through in many years, and it is equivalent to not only post-war stress, which is post-traumatic stress disorder was developed and diagnosed after the major wars, and the veterans and the war heroes came home, and the injured, and people had to deal with the combat that they went through. So that's how we developed the psychological field, developed the diagnosis. And then 9/11, we had the post-traumatic stress disorder become again in the limelight, which is 20 years ago. And then I think it was mitigated, and we used therapy, and we used whatever strategies we had. People were trying to mitigate the effect of 9/11. And now this is the highest rate of PTSD that we've seen since 9/11. We have sporadic trauma and disaster all over the world, but this has been at a level that has caused great harm. And Christina, I really appreciate you describing what it's like for nurses and doctors in the front line, because I feel that our culture is to just sweep things under the rug and pretend like it's all better and things aren't as difficult as they are. And there will be an aftermath, and there will be the triggers. We're scarred psychologically from this, all of us. And for the frontline caregivers and in the healthcare providers, it's going to be even more devastating, which is why we have seen suicides and why we are seeing an increase in addiction, and people are trying to cope. So the harm reduction strategies are so important right now. We're trying to mitigate the mental health consequences. But first and foremost, I wish we would recognize what the healthcare professionals, the medical staff has gone through, because I just feel like it's just going to be not ignored, but we're not going to remember how difficult it was, and then how to help and provide support services for those that have gone through such a horrific year. And I think the more we talk about it is the more we are able to provide support. If we just ignore it as if things aren't happening, that is probably the worst consequence that we could inflict on anyone. So I hope we provide more services. I hope mental health is more, the communities seem to be more specifically focused on medicine, the medical part, the physiological part. Now all we talk about is vaccines. So it's almost as if you're being ignored now, all of those heroes that worked so hard. And I just can't imagine the devastation in their life, in everyone's life that's been frontline, because it's traumatic for us to just watch and know someone, but to have to deal with it every day is, to me, it's stressful and it's constant, and I just don't know how people are struggling. You know, they're struggling, but they're getting through, right? So it's a difficult time. So I appreciate everything that you just shared with us.
All right, thank you very much, Dr. Azzat, Dr. Lisa. I would like to read some of the comments that we have on Facebook. Actually, right now, we have a message from Miss Anastella from New York City. She said that she was taking care of the sickest COVID patients. At the same time, her mom passed away of COVID herself. Okay, and we have a viewer from who's Miss Avinella F. Nell, who's actually watching right now from Tabuk, Kalinga. And we have Miss Virginia Baltasar. We have Miss Marisa Zapanta, Anthony Martinez, and other people are actually watching right now. Miss Layman Niego, who's actually watching us right now from the Philippines. Thank you very much. Thank you very much for watching The Glass Half Full with, of course, with Dr. Lisa Blanchfield and Dr. Azza Azzat. All right, to continue, I have a question for both of you, and also if you have some questions to our panel, we have with us Roberta, Christina, Sylvia, and Diana. All right, my first question: what kinds of mental health issue does the caregiver may face, or any one of us, especially during this time of pandemic or the crisis?
Well, you have the PTSD, of course, that is going to be, that it just comes out and you don't know when it's going to come out and what's going to trigger it. So we have a big, it's a very big issue right now. And then there's the whole dealing with loss. That the mourning of all the loss that we've had is just incredible. And every single patient that we've had, we've literally mourned their loss. And then you move on. Like, you know, so it has been, you know, very hard to compartmentalize. So a lot of people, you know, suppress their emotions. So I think we're going to be dealing with a lot of suppressed issues that are going to, you know, rear their ugly heads at some point. And you don't know what is going to trigger it, where it's going to come out. Could be someone lash out for no reason, and it comes from that. And, the longer that they keep it and they don't talk about it and they don't find something, they need an outlet. Everybody needs an outlet, a healthy outlet. Talking to normal people. I mean, if you have someone that'll just listen, that's one thing. But then when you have, I have people that I've spoken to that just listen, and then I've had people that I've spoken to that actually just want to talk back at you, and you just need to listen. I don't need you to tell me how to deal with something. I just need you to listen to what went on and, kind of take it in and then be like, wow, that's hard, how are you dealing with that, and what do you do in order to, to enjoy yourself and, bring yourself back to, because it was really hard for me. I can tell you, I isolated and I shut down, and I had to really build it back up and try to do things that I enjoyed doing on my own until I could get back to being with my family and being able, and I would talk to them, and I also would talk to, my coworkers too, and we would discuss what was going on with each other. So we kind of became like a unit where we could be each other's outlet. And some of us stayed silent, and those people they started talking after they were triggered, and that's how we all knew what everybody was going through. So, I think that's a big thing, is the triggers are going to start coming out from all the suppressed issues and suppressed loss and everything that's going on, because it really has been traumatic on both sides, the patients, the families, and for the staff.
Okay. Would you like to interject on that, Dr. Melissa?
What was that?
All right.
Dr. Azza?
Any comment on that, Dr. Azza?
One good thing will come out of our conversation here is just to understand that there are behavior that we can control, and being the healthcare provider in general, not just the nurses, I would see that they're very resistant to health, like mental health. So we always, as a nurses or a healthcare provider, we fear that we are in control, we are taking care of everybody, and we shouldn't be asking for help. So I would like to encourage all the healthcare providers to understand that we are all human beings, and it's something like if we don't address, if we don't deal with, it will just get worse and it will not disappear. So it's better to bring it to the surface, to understand your emotion, you understand certain sign if you are just emotionally eater. If you find yourself you're just eating to relieve some pressure, that's sort of addiction, that's sort of escape, that's sort of filling some gap inside you. If you notice that you are not making the right decision, if you are taking a glass of wine or increase it because it was one before and you find excuse for it, that's usually a sign that there is some underneath kind of a trauma or a gap or pain that you're trying to deal with, and you don't have to deal with it on your own. There is nothing wrong, there is no guilt feeling. We are human beings, and that was a big trauma and big challenge, and big challenge you need a big kind of tools to deal with. And I would encourage every single person not to just try to do it on their own, to seek mental health specialists or some trusted friend, and just be on the alert that it's going on.
Thank you very much, Dr. Azza. All right, would you like to interject on that, Dr. Lisa?
I think we already had a mental health crisis going on in this country for many years, and we have high rates of addiction and the exacerbation of the pandemic. So we had underlying mental health concerns and lack of quality service and accessibility. So since the pandemic, especially for nurses and doctors, EMTs, and anyone that's in the helping profession, now it seems that all of that stress and worry, and life is not easy for many people. It has now become so much more emphasized if you have a mental health diagnosis. So in other words, if you had anxiety, this past year obviously did not help us. It would increase your symptoms, increase the behaviors, addiction, addictive type behaviors, anything that would help us to try to mitigate the feeling that we had. So I think that the stress that has been put on all of us throughout the world in the past year has just made it more pronounced that we have mental health services available, but obviously not enough. We don't have the focus, and there's also the stigma, especially for healthcare providers. I think that we're all supposed to be invincible because we help people, but our own problems, as Azza said, are ignored, or we kind of don't recognize it because we're so busy being there for the other person. So people don't ask us, how are you feeling? It's not really that important. Even if we say it, it's for 2 seconds and then they move on because they've got so many things that they have to express to a doctor, to a nurse, to a frontline person, right? So our healthcare needs and especially our mental health is many times ignored, and we have to have more of a focus and services available for healthcare providers. There are now emergency 800 numbers due to there were suicides related to the doctors that were working in New York City when it was extremely stressful in the beginning of the pandemic. And since those deaths occurred, they have developed a hotline for healthcare providers to call, to talk, to be linked up with a psychotherapist or possibly a psychiatrist to try to prevent future suicides. But that's how extreme it was. And Christina described it. And I don't think we all realize it and accept how difficult it was and still is. But I think the awareness and paying attention to it and really being concerned is where we should be. And I think we've moved on. I think we have always crises in this country that we're concerned with. But the issue will always be there, and it will just be ignored until there's probably some sort of, the illness will become much more severe, and then hopefully the person will get help.
All right. Thank you very much, Dr. Lisa. Now that you have mentioned those numbers, I would like to mention that taking care of yourself can better equip you to take care of others. Also, during times of social distancing, it is specifically important to stay connected with your friends and family. Helping others cope with stress through phone calls or video chats can help you and your loved ones feel less lonely or isolated. There are actually numbers that you can dial. During times of extreme stress, people may have thoughts of suicide. Suicide is preventable, and help is available. More about the risks of suicide, signs to watch for, and how to respond if you notice the signs in yourself or a friend or a loved one can be found. You have to call this number if you're in crisis. Get immediate help. Call 911. Or National Suicide Prevention Lifeline. I would like to give you the number 1-800-273-TALK or 1-800-273-8255. There are other numbers that you can actually look over when you look for that for the mental health and crisis. All right, so please that number is very, very important. Again, if you are in crisis, get immediate help. Call 911. And a lot more hotline numbers that will be able to save your lives. Okay, to continue, Dr. Lisa and Dr. Azza, our experts, our hosts of the Glass Half Full, and of course we still have our panel: Christina, Roberta, Sylvia, and Diana. Diana did mention something about COVID-19 having a lot of fear. Is that normal in this type of situation, Dr. Azza?
She's talking about the fear?
Yes.
Okay, we just have to keep in mind also when Lisa and myself talking about the struggle of the healthcare provider to deal with the stress and daily routine and everything else. Keep in mind also that there are fear of losing their job, because now this is their income and that's their stability, so they are pushed to the limit. So when somebody's not just ignoring their mental health, but pushing through the struggle in order to keep their income, job security. It creates more unhealthy kind of environment and stressful situation. I would say toxic situation, because now you are working and you are not taking care of yourself. So fear in any situation is not really helpful to anybody. And being scared or afraid from job security, and some nurses are out and not being replaced, and the healthcare provider working on sometimes less staffing ratio, that creates some kind of uncomfortable fear kind of condition, make the healthcare provider trying to stretch themselves in unhealthy way. So it backfire and it affect our health, and that's where we try to talk always about self-care and your own kind of in charge of your own health and life per se, especially during the tough time.
Thank you very much.
Set a priority, yes.
All right, thank you very much. Would you like to add on that, Dr. Lisa?
Well, I speak to people who are healthcare providers who actually have contracted COVID. So they've been sick themselves, which is a whole nother level, not only fear, but they're out of work and they have to have, Azza, you know better, it's a negative test to get back into work. So they're actually exposed to it, getting it, and then
2 weeks, yeah. 2 weeks, yeah.
2 weeks after a negative test.
No, after exposure or after a positive test.
Okay, so even if they are sick and ill with COVID, they can go back after a 2-week period. But there's also concerns about their jobs and what's happening. And then the more nurses and doctors that are becoming sick from COVID, that also is putting a strain, because who's working then? Who's there to help the patients if they're getting sick themselves? So it started to become this vicious cycle of taking care of the patients and they're getting sick, and then their families are getting sick from them. So now children, I had one family, the whole house became very ill. So that's fear. I mean, you have to be afraid. You have to be afraid for everyone in your home, your parents, if they're elderly, your children, because we don't know enough about it. It's affected everyone. So there's just so much unknown also about the disease, about the virus, and the long haul effect and what happens. Some people are having issues for 6 months to 1 year after actually recovering from the virus. So I just think it's so difficult. We're all struggling with it, and I think that the more we can talk about it and recognize what's happening, and support people. The support is really important. If you know anybody who's been through it, had it, their families have had it, they're suffering, they've lost their jobs, lost their businesses, lost their income. We all just need to really support each other as much as possible. And I don't think it's going to calm down anytime soon, because we have this after effect of what's been happening. It's been a whole year. Can you imagine? It could take at least another year to recover in all the ways that I mentioned. So I think there should be more awareness and talk and discussion about it.
Can I also add to what you were saying about the fear and the people who have gotten, like, of getting sick and who have gotten sick, the frontline workers? So we had so many. So when we were first treating it, the doctors at first were treating it as like they would treat it like regular ARDS, and it would go from the protocol was to go from 6 liters to a normal breather to intubation. But before that, they were aerosolizing the COVID. So when you called a rapid response, that nurse was in there with aerosolized COVID for 45 minutes to an hour, coding these patients. These women were coming out, would break down and start crying. Oh my God, now I'm definitely positive. Now I'm going to give it to my kids. We had people that lost babies because of the clotting factors. of COVID. So there was a few nurses that actually lost pregnancies because of it. It's a whole, the fear is still at like a crazy high because you don't know. And that, so the COVID positive, if you come up COVID positive, but you're asymptomatic, you still have to come to work. So until you start exhibiting symptoms, you're now working on a COVID positive floor because you're COVID positive. So you're more at risk to exacerbate whatever COVID is in you because it goes by a viral load. So the more viral load that you're introduced to is the faster you're going to be infected by the virus itself. Because that viral load needs time to build up for you to get sick enough to be that sick. Just because you get sick from COVID doesn't mean that you're going to get the COVID pneumonia that people are getting. But it's that fear that you don't know if you are going to fall within that, that worst case scenario, or if you're going to be on the lesser side. And it's really rolling the dice with people's lives, which is why everybody's so stressed out and on edge. I have people that are walking around like in full armor. They weren't letting us use our own PPE at one point. They were giving whatever they gave us. They were giving us. And if we went out and got the better PPE, they were like, "No, that's not regulation. You can't use it." So it was just really scary for everyone for a while. Now they've become a little bit more accepting because people are leaving. Like half the staff, there's a lot of people that have quit. And now we're so short-staffed and have all these travels coming in that it's been insane. So you have that too. That's what I think a lot of the fear is, stemming from you don't know. You really don't know what's going to come next and what's going to come flying at you. And the way that the hospital has been handling it's just more administration than anything else, which is why everything's so up in the air. Like your boss, your manager can tell you one thing, but administration could change the policy the next day. And now it's something new that you need to do, or you need to not be doing, or you should have been doing. So everybody is really on edge all the time. So you have that too.
Okay. Thank you very much for that, Christina. And that is very true. It's very frightening. A lot of negative situation had happened. But my question is for our two experts. What are some coping skills to help manage our struggles or the caregiver struggles during this pandemic crisis?
I think the most important thing right now is to be aware. And as you mentioned, you reach out to somebody that's struggling, that you know that they are isolated. And this phone call, you have no idea how much it really touch and affect the person's life. Like you just have to call somebody. I remember I called a person who I didn't call for a long time. It was one patient of mine, and she was at home, and she was like, you feel like you just brighten her day, and she feel like she's not alone. And that small act of kindness, it can give you also help satisfaction. And you just tell the person you will be okay. You just have to do what you have to do, wash your hand, keep distance, wear your mask, and you still have to live your life because it's just like I always talk with my friend Roberta. I said, like, people are trying to hide and to save their life, not to live their life. What kind of quality? So we try to balance quality of life, even to go and to understand that they are not alone, and they understand that hopefully it will be over, and whatever decision they're gonna make regarding, because right now, even after coming with a solution, which is a vaccine, you need all the struggle and the fight and which one is better and complication. And there is nothing always perfect in life. You just have to make the decision based on risk benefit and based on what is your risk, and you have to live with making that decision instead of just being always negative, afraid, listening to so many bombarded news and overwhelming yourself. So just minimize the exposure, the negative exposure, that it's not going to help you. Anything that can help you and can really assist you in evaluating the situation, protecting yourself and your loved one, definitely you have to listen to. But anything that will just put some fear and you will feel helpless and there's nothing you can do, I think you should stay away. That's the best. Being in charge of your life and setting the boundary to what you're gonna get into your head and what you're gonna be filling your head of, because it can be overwhelming. And you can imagine if somebody helpless and just relying on the social media and they just came across something that they would think it's real, and how many times you heard about end of life and this is gonna end, or it's gonna end, and it can be frightening to some people, and we should be trying to just put some facts as much as possible.
All right, Dr. Lisa, talking about quality of life in this time of pandemic, how are we going to start doing it? Accepting that this is going to be our norm for the meantime is part of that, or what are the ways that we can accept that this is our reality?
We have discussed before, so it's kind of the basics that we go over with the self-care. You have to go back to getting enough rest, exercise, diet, try to avoid all of the negative behaviors that we do when we're stressed. So we don't have to isolate as much as we did. So I encourage people to get out of their homes because we've been isolated for so long, and to try to get outside and enjoy nature, walk, exercise, whatever you need to do. The socialization is coming to be much more relaxed. We can now start to integrate ourselves and socialize with others. So pick up the phone and try to get in touch with people. And just to kind of do an inner check on your feelings and your awareness and where you're at. Seek professional help, of course, if you think that it's going beyond something and it's interfering with your daily functioning. I always tell people, how are you functioning? What are you doing when you wake up, from the minute you wake up until you go to sleep? What are the behaviors? So we kind of have to do a self-check and then work with ourselves to try to understand what's happening. Of course, listening to the media and to the news is very depressing. Usually, they don't always give us good news. It's usually bad news. So try to turn that off. And if you use social media in a positive way, like what we're doing, or talking to people in chats, or trying to just find people in your social network to reach out to, of course, is always helpful. And I think that if we continue to recognize that we do need help and how to get the help and seek the help, it's usually the first step. 50% of the problem is realizing what's wrong. And if we can verbalize that, then we can obviously make some changes and try to help ourselves to feel better.
All right, thank you very much, Dr. Lisa. Okay, so before we continue, I would like to give a big shout out to our viewers. Marisa Zapanta, my sister, of course, Jefferson from the Philippines, Miss Ralphin Nan. We also have Miss Elma Kiambao from California. And also Idol JP Mendoza is one of the singers from the Philippines. We have Miss Lei Maniego again, Virginia Baltasar. We have Avenelib, Efnel, Miss Estella from New York City, Miss Anna Stella. We have Jemaru also, who's actually watching right now. All right, I have a quick question for you, Dr. Lisa, because you traveled a lot. So what are the things that you are telling to yourself not to be fearsome about traveling? Because I know most of us are so scared.
That's the secret that you weren't going to let out, that I've been traveling. Well, I have been vaccinated ×2. So now that everybody keeps saying, where are you and what are you doing? I can say, well, I have been vaccinated. So, but I did just have to travel for family. I honestly have not been on a vacation, which we all miss. I see people now starting to try to get out and do things. the safety issues are the same, whether we're vaccinated or not. You have to follow the protocol. I understand some countries even, I heard today that Greece is allowing Americans to visit if you're vaccinated and if you've got a negative test results. So I think that it's all protocol we have to follow. We have to listen to the experts and see what they're telling us is the latest and work on, our own plans. I don't think being isolated has really been healthy for us psychologically. So whatever, even if you can do a long distance drive, and not get on a plane, you want to just do road trips with your bubble, with your family. That's safe. And then wherever you're going, you just have to follow the rules. We can't just walk around now without masks because they even have cases of people who have been vaccinated who have contracted COVID, right? So we just can't let everything go because we're seeing a spike now. And that was due to spring break and a lot of people traveling and saying this isn't a problem. It is still a problem. So we have to follow the rules. We don't like to do that. We like to say, oh, I don't need to go with the CDC guidelines, but unfortunately we have to do it. And we have to do it probably for some time. And in that way, it's safe and you're just following whatever regulations that the government has told us work, right? So we know what works and what doesn't, and we can't congregate and we can't have lots of people that aren't social distancing because the variants are out there still.
Thank you
So
very
we're
much.
seeing this.
All right, Dr. Lisa, I know it's not a secret anymore. Okay. All right. So Dr. Azza, you've been chatting with Diana, one of our panel on our chat room. So what are the some of the fear of the unknown that you were referring to? Maybe our viewers will be able to understand it better as well.
I think we are not sure what exactly, if you're dealing with a disease or illness or something that you're aware of, where it's coming from, how you protect yourself, and what is the end of it, it will be a different situation. But up till now, everything is still in investigation, research, and possibility. So nobody came out and say this is what it is and that's what we're gonna do. Everything that it's at this point is still a guessing game. And we say we controlled it, and then we come and say there is another second wave, and then they said no, we're able to find a solution now, let's just get a vaccine, and then we say no, there is complication. So it's in the unknown stage. It reminded me with the HIV, where it first came and we were afraid even to touch the patient. Just to go to the room and touching him, it was like we were so scared because it wasn't something that we are aware about. It's something that was disability at that time. Right now, after we got enough information and we knew that we contracted through touching or even kissing or sex, we had infections control consultant that we said one woman will sleep with 200 in order to contract it. So then you get to be more confident about dealing with this. But right now we have no idea. They said this virus, and we've seen that this virus start after 6-7 months affects a different organ. I have few friends that they started with the COVID and they were cured, everything was perfectly fine, and then start having some complication. And when she went to specialists, they said it affected big part of the heart and she has to go for some tests and some other stuff. So it's unknown. And we are not hearing, but maybe because we're in the healthcare field and hear more, it's still unknown. And don't believe anybody can tell you they know what it is. They know that it's possibly a remedy because we could say ability that it's not just for the virus. So right now we are facing a war. We are facing some kind of the unknown.
Absolutely.
And that's not good because you know your enemy. You're able to stand up and to face him and to deal with it. But when you not sure who's your enemy, it's difficult from all. And that's where the confusion, where people, there's no trust right now. There's even there are big population, they don't trust that this is going to help us. There are so many theories, and you cannot help but to fall into the trap and say, you know what, I don't trust anybody. I'm just going to rely on myself and get to know my body and get to help myself to the best of the ability. And some people start to have like rely on faith, and some people start to rely on themselves. And it's been a lot going on in the last, I would say, 2-3 years, and there was a lot going on.
Thank you so much. I would like to ask this question to Christina. Christina, are you still with us?
Yes, I'm
All right,
here.
Christina, you have a taste of a first-hand experience about this pandemic. We salute you. We salute all the people, the healthcare workers. I don't know if we are really not afraid of the situation, or we're just trying to do our best to fit in into the to the current situation. But in your own case, how did you manage to survive both mentally and physically of the strain, the problem, the weight of this pandemic?
So what my own personal view was, I saw this as I had to take it day by day. So I knew I was coming in and it was gonna be like a war zone. At one point, we were given, so we had huddles in the beginning of shift and at the end of shift. And in the beginning of shift, they would tell us what our duties were, and we were having a lot of deaths that were in the start of it. So they said if we found, we were doing the vital signs every 4 hours, because you could be fine 1 minute and you could go bad very fast. Within 3 to 4 hours, people were desatting all the way down into the 50s that were at 100%, 90%. And
Wow.
there was nothing we could do. You know, we were bumping them, we were turning them, we were treated like ARDs, we were doing chest PT, we were proning them, everything. And so what they told us to do was, if we found someone that had passed away, we were to leave them and move to the next patient. And we were supposed to go to the next patient and to save their life, because this patient had already expired, and then come back to them. So we had to just leave them laying there. So that was like really big, like for us to get used to, because we were so used to like respecting, you know, the death of somebody and like being on top of it. And we had to keep it moving, because the next person could be going out. So we had that. So every day when I would come in and it was just changing constantly, I began to just go with the flow. I didn't expect to walk into anything, and I would go in with the positive attitude that I hope today's going to be a little bit better. I hope today's going to be a little bit better. And that's kind of how we had to look at it, because you can't bring in what happened yesterday, because we didn't know what today was going to bring. It would constantly change protocols. So as the protocols changed, the patients got better. So we're now at a point where I think that we've got a good handle on how to treat it and how to get people past that hard point, but we still have that lasting effect of when we were kind of throwing, you know, spaghetti at the wall to see what sticks, you know, because that was really what they were doing at first, because we didn't know. We had it when it first started showing up. We had patients coming in that would put on airborne precautions, and they were put into the airborne rooms, and then ruled out for RSV, TB, any type of airborne respiratory issue that they may have had. And then once they were cleared on that, they were like, well, it must not be airborne. So then they took down the airborne precautions, and they had nurses and PCAs going into this room with the person who had COVID, because we weren't testing for COVID, because we didn't know COVID was here yet, and everybody was getting exposed. So it was really rough in the beginning, but the way that we got through it was we just took it day by day. Like each of us took it day by day, and like I said, a lot of a lot of people were compartmentalizing and like suppressing down what they were feeling, but then it came back. Now it's kind of coming back now.
All right. Thank you very much, Christina. That it's so hard to listen and imagine what is actually going on that situation. It's indescribable. Okay, all right. So we do have like few more minutes to go. I know we've been talking about the mental health concerns during the pandemic, the COVID-19 crisis. What is the advice that you can give to the audience, our audience, in order for us to have some positivity and some strength that will be able to hopefully pass this and go back to the normalcy? Would you like to start off, Dr. Lisa?
I think that we all should try to communicate better and work on talking about it. And Christina describes the actual stress that healthcare providers experience. And I think that even though we think we're strong and we think we can get through it, we just need to rely on others. And the positive side of it is that we do have resources available and we are all trying our best, either as volunteers or we have people that are now reaching out who are providers, mental health providers that are coming back into service, back into the communities, trying to provide as much support as we can. So try to reach out, I would say, and try to find resources. We have national, federal programs, we have state, we have local. New York City has great numbers to call when you feel like you're in crisis. They have actually COVID crisis phone numbers, which is anything related to COVID. And I think that our government has tried and done the best they could, and New York City has also developed a strong network of people who are supporting all of us. So I would say reach out. To be in isolation and to not discuss how you're feeling is probably the most dangerous. And I think that we worry a lot about those that are struggling and not looking for help. And so I would encourage that. Probably the best advice I could give you.
Thank you very much, Dr. Lisa. Okay, Dr. Azza, any advice that you can give to us regarding this
Yeah, the advice that I would like to give, and that's what I give myself, is to try to build and have more faith and build trust and relationship. We should start to trust our country, our healthcare system. We have to build everything again, including our own behavior, attitude, caring for ourselves and other relationship. So we should take it as a time to rebuild ourselves and our relationship and our community and our nation, and to think human, be human again, to understand that we are human being and we, like Dr. Lisa said, to seek help when needed and to give hand as well. So we have a lot of work to do, a lot of healing and a lot of relationship to build again. So to have faith, that's my suggestion.
Thank you very much.
I agree very much with both of you, and I think one of the main things for like self-care would be to get rid of the stigma that's attached to mental health. Where people they're so stigmatized, where people think that going to a mental health professional in order to talk about things that have gone on and traumas that they've actually experienced is going to label them somehow. Mm-hmm. So we gotta somehow get everybody past that stigma, because self-care, that's the major thing that, that's what's keeping them from going, because they think they're going to be, labeled and it's going to follow them. Because I had a lot of people that didn't think that, I don't need a therapist until they really did. They realized that, okay, maybe I do. But it's that stigma that keeps them from going when they first feel it.
Thank you very much. All right, and I would like to add on that note that learning to cope with stress in a healthy way will definitely make you, the people you care about, and those around you become more resilient. Take breaks from watching, reading, or listening to news stories, including those on social media. It's good to be informed, but hearing about the pandemic constantly can be also upsetting. Consider limiting news to just a couple times a day and disconnecting from phone, TV, and computer screens for a while. Take care of your body. If it's available, get vaccinated with COVID-19 vaccine. Make time to unwind, connect with others, and connect with your community or faith-based organization. And of course, one thing that I would really like to share and advise everybody, and I think this is going to be very important also, is what? Dr. Lisa and Dr. Azza is always try to watch the glass half full as a habit, right?
Right?
I think we need 7 days a week though. We gotta be available, right, Azza?
That's absolutely it's like really release some of the pressure on you too when you help somebody. It helps both people, I believe.
I know, and as the future, as we go on to the future, and hopefully one day we're gonna be back in normalcy. To all our viewers around the world, especially in the Philippines, we have a lot of patrons in the Philippines. Please watch out for Dr. Lisa and Dr. Atsa, right?
Have
Okay.
we traveled to the Philippines yet? Are they gonna let us in or we don't know?
Yeah. All right. So, but anyway, if there are some viewers, Dr. Lisa, Dr. Asa, that they would like to reach out to you, I've seen a
Yes.
lot of appreciation on our Facebook, thanking you both.
Yeah.
Where they can follow you, aside from
They
MJ
can-
Make My Day.
They can follow us both. We both have pages on Facebook. Dr. Azza has hers and I have mine. So that's probably the best way to connect for now, especially if they're international.
Absolutely. All right. So I know we've been talking about advice, but before we end our program, any positive thoughts? I'm gonna start with Christina, and we're gonna go to our main host, Dr. Lisa and Dr. Asa. Any positive thoughts, Christina?
I think we just gotta keep pushing through. Like, it's getting better. People are really recovering well, and we are. I see the light. I see the light at the end of the tunnel. Things are going to get back to normal. It's just going to be. We have to get used to the new normal, and it's going to be all right. Like we're getting to a point where things are stabilizing, and herd immunity is happening. So even though these waves keep coming, it's each time the wave comes, it's not as bad as the last. So we just got to keep pushing forward, and we're getting there.
All right. Thank you very much, Christina. We really appreciate your time joining us for tonight. Dr. Lisa, positive thoughts for our audience.
I agree. Christina has the right attitude about it. We are going in the right direction. Hopefully, the numbers will continue. We can only hope to decrease the stress on healthcare providers, hospitals, doctors, our whole healthcare system. Hopefully, as well, we have to have faith will continue to be less stressful. And I think that we have to be positive and hope for the best. Our faith is always important, as Azza mentioned, to be humble and to just know that we are all in this together. It's one day at a time, but it's also affecting everyone. It's not just certain families and certain people who have lost a loved one or those that have been sick. It really is something that we share as a community and as a country, and actually the whole world has been suffering through this. So I think to know that it's a system of support, and that we're going in the right direction. A year ago, it was much more dismal. So I hope that we will continue, and life will open up our possibilities of self-care and coping, and things will obviously go in the right direction.
Thank you very much, Dr. Lisa. Dr. Azza?
Okay, so now on the positive part, is there anything we can celebrate today and say congratulations? So we have to really enjoy every moment because it's a moment after a moment. It causes big, nice momentum to enjoy. So if there is anything nice and good going on, we should celebrate it as well. So we have to remember also and count our blessing and realize that there are so much going on, a lot of blessing going around as well. And congratulations and good news. And to be positive, like if you really think and take a moment to connect with yourself and inner being, and you will find a lot to be thankful for. So let's take the moment and be appreciative of what's going on in our life as well.
Absolutely. Thank you very much. Every day we should be congratulating ourselves, our loved ones, and of course everybody for just staying strong in spite of the challenges that we're facing. All right, and it's been. All right. Before we end our program, would like to invite everybody that tomorrow I'll be conducting a seminar again. It's going to be a 9-hour seminar for those who would like to be a certified dementia practitioner. I myself is a certified Alzheimer's disease and dementia care trainer. So if you would like to be a certified dementia practitioner, taking care of our loved ones, our friends, or our elderlies, all right, older people, and walking through their journey. It's a very unique but beautiful journey, all right, for people or person with dementia. So please join me on my seminar tomorrow. You got to contact Life's Next Chapter Foundation is also the presenter of this program, NJ Make My Day, featuring the Glass Half Full with our expert, Dr. Lisa and Dr. Azza. And of course, I would like to say thank you very much to 1120 Consultants and to my baby Yum Yum. Yeah. All right. And happy viewing, everyone. So there you go. Thank you so much, Christina. We also have to thank Diana and Dr. Lisa Blanchfield and Dr. Azzat. Thank you very much. It has been a good program again, as always. And of course, we're going to be seeing again every third Friday of each month the Glass Apple with our expert Dr. Lisa Blanchfield and Dr. Azzat. Once again, my name is MJ and you're watching, you just seen MJ Make My Day, and we'll see you again next week. Thank you very much, everybody.
Thank you.
Thank you. Have a good night.
Bye.
All right.